Good evening and welcome to today's Health Special. Reports from leading healthcare organizations have once again placed hand hygiene in the spotlight as one of the most critical yet overlooked factors in preventing hospital-acquired infections. With increasing patient morbidity, extended hospital stays, and rising healthcare costs, the issue demands urgent attention. But nurse leaders must too. With mounting pressure from both the public and healthcare regulators, nurse leaders are stepping up to drive critical changes. The proposed solutions include mandatory compliance audits and real-time feedback, regular monitoring and instant feedback mechanisms to ensure healthcare workers follow proper hand hygiene procedures, stronger leadership accountability and role modeling. Hospital leaders must set the standard by actively promoting and enforcing hand hygiene protocols within their teams. Enhanced staff training and behavioral reinforcement, comprehensive education programs aimed at reinforcing proper techniques and emphasizing the consequences of non-compliance. Infection control policies integrated into daily practice. Hand hygiene must become a non-negotiable element of hospital routines embedded in every aspect of patient care. The numbers don't lie. Now let's take a closer look at the latest figures from Health Quality Ontario. This graph exposes the fluctuating hand hygiene compliance rates in hospitals across the province. While some institutions have made improvements, others still fall dangerously short of the standards necessary to protect patients. The evidence is clear. Stronger regulations and enforcement are needed to ensure hospitals uphold proper hygiene protocols. As the debate over infection control intensifies, one thing is certain. The fight against hospital-acquired infections starts with clean hands. Will Toronto hospitals take the necessary steps to improve, or will this preventable issue continue to endanger patients? Here are Jenny and Abhishek to talk more about this issue and explore additional insights on how we can enhance hand hygiene compliance in hospitals. Again, this is Teresa reporting.
Everyone, I will be discussing the issue and relevance for healthcare-associated infections. In Canada, approximately 220,000 patients acquire HAIs annually, leading to increased morbidity, mortality, and healthcare costs. For hand hygiene compliance, despite its critical role in preventing HAIs, hand hygiene adherence remains suboptimal among healthcare workers. A 2022 meta-analysis reported compliance rates of 52% for nurses and 45% for doctors. Our group identified solutions for hand hygiene in hospitals in Toronto. First, alcohol-based hand sanitizers. Implementing readily accessible alcohol-based hand rubs at point of care to facilitate quick and effective hand hygiene. Second, visual reminders. Utilizing posters and signage to prompt hand hygiene practices among healthcare workers. Number 3, electronic monitoring systems. Deploying systems that provide real-time feedback on hand hygiene compliance to staff. Lastly, staff education and leadership engagement. Emphasizing the importance of continuous education and active involvement of leadership in promoting hand hygiene.
Jean Watson's theory of human care is highly relevant to improving hand hygiene compliance among healthcare workers in Toronto hospitals. Watson's theory emphasizes the importance of caring relationships in nursing practice and highlights the ethical and humanistic aspects of care, which directly relate to infection control and patient safety. Application to hand hygiene compliance, education and awareness. Training programs can incorporate Watson's caring theory, reinforcing that hand hygiene is not just a clinical task but an act of compassion and ethical duty, according to CNO in 2022. Leadership and role modeling. Nurse leaders should demonstrate and reinforce proper hand hygiene as a caring behavior, influencing staff compliance through role modeling from RNUEO 2021. Patient-centered approach, engaging patients in hand hygiene. Education fosters a partnership in care, empowering them to remind staff about hand hygiene compliance in a respectful way. IPAC Canada 2023. Our group expected outcomes: increase in compliance rates, enhance adherence to hand hygiene protocols among healthcare workers, reduction in health-associated infection, to lower incidence of infections acquired within healthcare settings, improve patient safety, overall enhancement in the safety of quality patient care. Our group sustainability plan for the next 5 years: continuous education,
regular training sessions to keep staff updated on best practices. Next, leadership development, cultivating transformational leadership skills among nursing leaders to maintain a supportive work environment. And lastly, monitoring and feedback, ongoing use of electronic monitoring systems to provide real-time compliance data and feedback. I am Jenny Michelle Ragos reporting.
Hello everyone, my name is Abhishek and I will discuss the evaluation outcomes for hand hygiene initiative aimed at improving compliance in Toronto Hospital, how it will be evaluated. The success of this initiative will be assessed using both quantitative and qualitative data. First one is quantitative data. Compliance will be monitored using electronic system and direct observations with a goal of 90% adherence. A 30% reduction in healthcare associated infection is expected within 6 months. Self-reported compliance survey will be used to assess staff and hygiene performance. Then comes qualitative data. Interview with medical staff will identify challenges and areas for improvement. Then patient feedback surveys will be measure transparency and accountability, overcoming barriers. Several challenges may arise, but we have still solutions resistant to change. Transformational leadership and educational program will motivate staff and encourage compliance. Time constraints. More hand sanitization station will be placed in key locations to improve workflow efficiency. Then limited awareness. Training seminars will be reinforce clinical standards and patient safety. Impact on stakeholders. This initiative will benefit first is staff, improved workplace security and professional responsibility. Then leadership, compliance with infection control regulations, enhancing hospital reputation. Then patients and families, lower infection risks, improved hospital trust and better health outcomes. In conclusion, Toronto Hospital will foster a safety-centered culture with greater accountability and patient care through this initiative.